Hello, everybody. I think I can take this off while I'm speaking. We are just waiting for some of the participants to join via Zoom, but I did want to go ahead and welcome everybody. Can everybody hear? Got quite an active group here. It's so exciting to see everybody, to see all the winners of the Ether Dome Challenge with the Patient Family and Advisory Council. But just want to wait just a couple of minutes to make sure that all of our attendees on Zoom have been entered into the Zoom session. So do I have the okay? Are they still trickling in? They're still coming in? Okay, great, wonderful. So officially, everybody, thank you for joining us here for the very first Patient and Family Advisory Council Ether Dome Challenge Award and Recognition Ceremony. We're really happy to have everybody here today, and we've got a pretty full agenda for the session. My name is Paula McCree, and I am the Managing Director of the Healthcare Transformation Lab, one of the groups responsible for bringing this program to patients. And we will hear from a number of different of the other groups that have participated in bringing this forward with the patients. But this is a wonderful program, and just a little personal story from me. I started with the Healthcare Transformation Lab in 2020, just 2 weeks before the pandemic. And during my interviews with Eric Isselbacher, the founder of the Healthcare Transformation Lab, he had shared with me his desire to run an Ether Dome Challenge with patients. And that was during the interview process, and I remembered that. And after we ran an Ether Dome Challenge program with Nursing and Patient Care Services, I thought, okay, now it's time to run one with the patients. And so I'm really thrilled that I've been able to achieve that dream for Eric as well as for myself, because it's been a wonderful experience running this program with the patients. I've had an opportunity to chat with a number of you through your idea submission process, as well as through supporting the application. So we're really very excited to be able to honor all of you here today, and those on the Zoom link as well who were not able to join in person. So the agenda for today, we have our welcome, we'll have opening remarks from one of the sponsors, Inga Lennis, and then I'll do a program summary. We have a couple of special mentions because there were some unique things that happened with this program that I really would like to share. And then we have all of our presentations. The certificates are going out to individuals who submitted applications but did not win the runner-up or the winner. And then we have the runners-up and the winners. I will go over some next steps and the overview, and then we will have closing remarks from Eric. So without further ado, I would like to introduce Inga Lennis, who is a medical oncologist at the Massachusetts General Hospital Center for Thoracic Cancers, and specializing in seeing all cancers and esophageal cancer as well. She is the founder and director of the Pulmonary Nodule Clinic at Massachusetts General Hospital, and works closely with colleagues to study and implement lung cancer screening and improve nodule management. Dr. Lennis is the Senior Vice President of Ambulatory Care and Patient Experience for the Massachusetts General Hospital and the Massachusetts General Physicians Organization. And it is in this role that she leads this program of the Ether Dome Challenge with the Patient Family Advisory Council. So Inga, thank you.
Wow, what a treat to be with all of you here today, and for those of our guests that are joining us online. So thank you so much for having me. It's just a treat. I want to welcome everyone here to the Patient and Family Advisory Council Ether Dome Challenge Awards and Recognition event. In collaboration with the Healthcare Transformation Lab and the Center of Innovation in Care Delivery, we launched this first ever Ether Dome Challenge program pilot with our patients. The Ether Dome Challenge is an open innovation contest that taps into the wisdom of the crowd to identify important challenges in a way that is easy for everyone to participate. Historically, this program has been run for staff in various areas across MGH. It was Eric Isselbacher's wish, as Paula just mentioned, to run this program with our patients in recognition of the value of their voice in healthcare, in the healthcare innovation delivery process. We're here today to honor the winner and also the 3 runner-ups in this challenge and to share what's coming next. Over the past 6 months, many of you have engaged with one another through the EtherDome Challenge platform. Whether you submitted an idea or you participated in creating an idea, voted for an idea, or completed or collaborated on an application, judged an idea, your participation in this pilot has been a key to its success, and I want to thank each and every one of you. There has never been a more important time to hear from you on ways to improve how we deliver care here at MGH. During one of the most challenging times in our history, we have faced this as a community. You have not only shared your pain points, but also participated in the process of finding and soon working on implementing, very exciting, resolutions ensuring your voice continues to be heard in the way that MGH delivers the highest quality care. We're pleased to see that many have submitted ideas that were in line with hospital initiatives that are currently underway. We're also inspired by the innovative solutions that you presented to address the pressing problems. Over the next months, the HTL and CICD will coordinate with us to support the winner and runner-ups. And in addition, we will continue to review all of the submitted ideas and reach out to continue brainstorming ways to move these ideas forward. Thank you all for being here today. Whether you are here in person or attending virtually, we have an exciting agenda ahead. Without further ado, I'm going to hand the microphone back to our MC for today, Paula McCree, Managing Director of the Healthcare Transformation Lab, who will start by sharing some of the highlights of the challenge. Thanks, everyone.
Well, thank you, Inga. I'll get right on to the next slide. Just to provide a little context for everybody, what is the EtherDome Challenge, the EDC? It's obviously named after this space that we're in, which is where we had the first anesthesia delivered within the hospital. So it's an innovative space that we are in a very a hollowed space within the institution. But in essence, as Inga described, the EtherDome Challenge is an open innovation contest, and it's intended to get to the people on the front lines and to hear the voice of the individuals on the front lines, and recognizing that everybody has ideas and that it's just a matter of having a way to express your ideas. And we created this platform in conjunction with the Harvard Business School, who's studying these kinds of crowdsourcing activities to support innovation, and came up with this is a way to anonymously submit ideas. And if you're not necessarily maybe submitting idea, but you can look and see what those ideas are and still have a voice through your vote. So we felt that this approach was a great approach to bring to patients. It's designed to encourage innovation from all stakeholders and create a culture of fun and support. So how does it work? Phase 1 is the ideation phase, and that's the phase during which whatever your idea is, simple, easy, low bar for submitting, making it easy to get your idea out there. And then the crowd votes. And again, this is all anonymous. Nobody knows who submitted which ideas. So you're really voting based on, does that idea resonate with you? And then the top voted ideas are the ones that are invited to submit an application. So applications are judged, and then we have our winners, and we are in phase 4. We are doing our awards today. So there is one more phase, and this is where I say the rubber hits the road. is when we start the implementation process, as Inga also referred to, looking at not only the winners and providing the support to the winners in terms of project management support as well as budget, but also looking at some of the other ideas that were submitted to see if maybe there are ideas that are already in progress. We have a couple of those now that we can connect the patients that have in fact submitted those ideas to those projects that are already in process. Or perhaps it's what we call a just do it. Not that I'm marketing for Nike, but there are a number of ideas that we feel like we could just do without necessarily needing, a full project management program. So the results from the very first Patient and Family Advisory Council Ether Dome Challenge, there were 8 PFACs within Mass General Hospital, approximately 125 members combined in all the PFACs. Most of those are patients. There are some staff that are also serving as patients with that group. And we had 26 ideas come from 18 different individuals. And this represented a 14% participation rate. And when I looked back at the previous EDC challenges that we've had, we exceeded the participation rate for all of the programs prior. And we had one in 2014, one in 2015, I think 2017, 2018, and 2021. So, yay. We did a great job in terms of the idea submission process. And then we had 20 ideas, 28 individuals voted for those ideas that were submitted. And that was about 22% participation in the voting phase, which was within range of what we'd experienced in the past. So from this perspective, I really feel like this program has been a great success. Also, every single idea that got submitted got votes. There was a minimum, I think, of 35 votes that the least voted idea received. We did invite 11 ideas that bubbled to the top to be invited to submit an application. That was almost half, but not quite. And because it was so close, the voting, and there were so many really great ideas. And all 11 ideas that were invited to submitted applications. So, and that I think is a first as well. So kudos to the group for those great results. So now to the next update information I want to share is just a couple of special mentions. As I had shared, there were some unique experiences that we had when I was looking at the data of the participation. 3 PFAC members submitted 3 ideas. And that was, the goal of the idea submission process is to make it easy. But the fact that there were 3 individuals that had 3 ideas and submitted them, it just speaks to the fact that you have ideas and that you are creative and that you have experiences that are valuable to us for sharing. So the 3 that did were Catherine Duffick, Kevin Profit, and Tracy Talbot. So congratulations to those 3. Tracy Talbot had 2 ideas that made it to the application process. So congratulations again to Tracy as well, who is here in our audience. Rosemary Marbach and Catherine Duffick, they are being recognized because they are from 2 different PFACs. And so it's our first cross PFAC collaboration with the challenge. So congratulations to Rosemary and Catherine. And in addition, their idea is an idea that is in process, and we are already starting to talk with the groups that are working on that project to engage them in implementing their ideas and their thoughts. So another great win for the group. So next, I would like to introduce my partner in crime here from the Center for Innovations in Care Delivery, Hiyam Nadal. Hiyam is the director of the Center for Innovation in Care Delivery, and I met Hiyam in 2021 when we partnered to run the Nursing and Patient Care Services EDC Challenge program. And that was a program that we ran with over 8,000 participants. And I will admit, and I've shared this with him, when I heard that number, I felt like I was a deer in the headlights, but we pulled it off and we had a great partnership. And he has partnered with us again to facilitate this program. So Hiam.
Thank you, Paula. It's so nice to see everybody here. So in my world, it is a well-known fact that the best solutions and the best ideas come from those closest to the problem and or are experiencing the problem. And this is exactly what we found here. So it is my pleasure to announce the certificates of participation. And after I've called all your names, please come up and we're going to have a group photo. First is Linda Klein from the general PFAC with her idea, the wrist beacon. Tracy Talbot from the general PFAC with her ideas. Is anybody out there? And lab work, call me maybe. Matthew McGinnis from the children's PFAC with his idea, e-learning support for parents of pediatric patients. And I think Matthew couldn't be with us today. Rosemary Marbach from the emergency PFAC and Catherine Duffick from the general PFAC with their combined ideas, navigation app for the MGH main campus. And finally, Kevin Profit from the emergency PFAC with his idea around wait times. Oh, no, sorry, one more. Ralph Verney from the emergency PFAC with his idea, continuous wait time displays.
So we can have Eric and
Inga and Deb, yeah. So next are the runners up, and we've asked them to come up individually and say a few words. Jonathan Parziali from the Heart and Vascular PFAC with his idea, information gathering prior to the appointment.
Thanks, Ian. Honored to receive this recognition. I would say, from my perspective, this experience was wonderful. Having a platform and forum for patients to help make a real difference in improving our experience, our level of care is wonderful, and I was just honored to be able to take part and submit an idea that hopefully we can see to fruition. Thank you. Thank you.
We'll have you come up later. Actually, we're going to have you come up and take a picture, yeah, individually.
Stand by here.
Thank you.
Next is Penny Blaisdell from the emergency PFAC with her idea, patient education about the patient features. Penny?
Good morning, everybody. I'm not a stranger to Mass General. my family and I have been a lot of blips, let's put it that way, in our radar, whether it's prostate cancer, breast cancer, leukemia, whatever. We love this place, and we would not be alive, my husband, my son, and myself, if it was not for Mass General. So that was the inspiration for me to come up with an idea about helping caregivers have access to the patient gateway. And it's not terribly easy. I did figure it out for my husband and for my son, but the process was not that easy. It was not that intuitive. And so I think that there's a need for instruction and education. And so that was my suggestion. I did have another suggestion, which I do want to share with you, though. And that is because I'm in the PFAC emergency room. I noticed that people with dementia, my husband has Parkinson's and Lewy bodies. The thought of my husband going into the ED without a caregiver, or at least somebody within the ED that can help them navigate, because they're totally lost in that situation. So I also was glad that I was able to do that opportunity. And the lessons I learned here is that you guys really listen. You really ask, you really care what we have to say. So thank you very much. Thank you very much.
Thank you, Penny. Next is Kim Whalen. I don't think I've seen her today. And Lynette Lavasco from the MGH PFAC with their idea, MGH Family Resource App.
Good morning. This idea came out of a conversation that I had with Kim Whalen, who's the director of the PICU. I'm a foster parent on the North Shore, and with one of my foster children, I've spent almost 2 months at Mass General this year. And just being in the hospital so much and trying to figure out resources in the hospital and people to talk to and just what was available to my foster son, my husband, and myself was really important. So I had many conversations with Kim, and it was just I'm really looking forward to collaborating with her more on this and developing this idea.
And now it's my honor to introduce Dr. Debbie Burke, who is the Senior Vice President of Patient Care and Chief Nurse. And I have to say, she offered me my full-time job because she really believed in what we were doing and the power of the front line to really come up with solutions and solve our problems. Debbie?
Thank you, Hiam. This is really so fun to be here and to celebrate with all of you. And I have to say, having been a member of PFAC committees myself for a long time, you always had the best ideas. And I'm so glad that we've been able to figure out how to formalize this and start to really move some of these forward. And of course, I have the great pleasure of announcing the winner of the first Patient Family Advisory Council Etherdome Challenge. Oh, thank you. And the winner is the Mass General Hospital for Children, PFAC. And this really represents a great team effort. The idea is called Help After Discharge, and was born from the challenges associated with managing a child with a chronic condition following discharge from the hospital. Several options were suggested in the implementation plan, which demonstrate the thoughtfulness of the team as well as the complexity of this issue. And the winning idea was submitted by Ashley Conti, Mary Bar Halpern, and Erin Quinney, supported by co-chairs of PFAC, Sandy Clancy and Dr. Esther Israel. Do I have some other? Yes, excellent. So I'd like to just share with you a little bit about what the idea was, both the problem and the solution. When a child with a chronic medical condition is admitted to the hospital, it's difficult to triangulate who to call when issues come up. The example given is a child with a trach who becomes really sick with RSV. Do you call your pediatrician? Do you go to the ED? Are there resources available for parents and patients to navigate common illnesses in children with complex needs? Oftentimes, pediatricians are not equipped to provide advice for complex children, but the hospital would like the pediatrician to be at the front line to avoid unnecessary ED admissions. So how can the hospital and family better coordinate care between providers? The solution of the team is to create a framework for parents on who to call and when. Create an automatic dialogue between the specialist and pediatricians once a child is diagnosed. Make it required that the specialist connect with the family's pediatrician, or have a way that providers and families connect or communicate effectively in order to better coordinate their care. Second idea is help families choose or change pediatricians to ones that can better serve the complex needs of a child after they've been diagnosed with a complex medical condition. So I'd like to invite the winners to come down for a certificate and for photographs.
Congratulations. I'm Ashley Conti-Smith, and this is Miri, and this really was a team effort from the pediatric PFAC. What was really striking to us is we found that all our children had different chronic conditions, and we all struggled to figure out care for them when they came down with common illnesses. And all of the chronic conditions were different, and we were all finding that this challenge we had faced at various times raising these kids. And what we found really rewarding about this process is working with the variety of stakeholders at MGH and really collaborating across the different teams, and also looking at it from the provider side. As a parent, you want all the resources you could possibly gather for your child, but some things are not practical in terms of getting one-on-one care.
You mentioned everything. I think very similar. We have two kids that were treated here at MGH. Very different experience. One was during COVID and one was before COVID. And in both of them, we really struggled after research to know what to do. We had an amazing opportunity to work together, all of us, and really, what was striking to me is that we all came from very different experiences, different illnesses. Our kids went through different things, but the discharge was really difficult, and we all struggled with that. So when we came together and thought about the ideas, I thought it was a great brainstorming for all of us, especially because we had Cindy and we had Esther and we had Megan, right? And Megan from who's doing research about it as well. So it was really nice to see all the different ideas coming together. And thank you so much for this opportunity. Yes, thank you.
I will say something.
Yeah, I'd love that.
Yeah.
Great.
What I will say is that what's been on my mind is that PFACs are really crucial to this entire process of thinking about infrastructure, right? Allowing families to have a forum where they can put forth their ideas. And I just want to reiterate, which something that I think somebody has already said, which is patients have the best ideas. They are absolutely the best. And so it's just so delightful to be able to honor them in a way that they should be honored. So thank you.
And I also want to just especially thank Sandy because she's been co-leading the Pediatric Family Advisory Council for a very long time. And it was always such a pleasure working with her. So I want to bring Paula back to the podium.
Thank you very much. And thank you, everybody. How about a round of applause for everybody? Great job. And thank you also for sharing all of your stories. As I mentioned, I did have an opportunity to chat with some individuals during the ideation phase and to hear the stories. And it really is heartwarming. And this is really what this is all about is, sharing your experience and coming up with ideas based on your experiences. So great job, everybody. So for some next steps, before I forget, there are parking passes for people who have driven and need a parking pass. I'm at that age where if I don't say things as they come to me, then I forget since it's not written down. And then, so next steps, many of you that have participated in a survey, and if you've not completed the survey, we ask that you do complete that. And just a reminder that 10 randomly selected people who complete it will receive a $10 Amazon gift card. So, as I mentioned, the rubber hits the road. Starting in January, we're going to be meeting with the winning teams and the runner-ups to start the process of the development of their projects. We will be reviewing the remaining applications and making connections with the appropriate departments within the organization. And we will also be reviewing the other ideas that maybe weren't submitted on application, but they all got so many votes that we want to just see if there's anything there that we can move forward and at least bring it to the attention of the appropriate individuals within the organization. And most importantly, we are hoping to expand this program beyond the PFACs. I mean, this was a pilot, and I feel like it has been a very successful pilot. And I also want to just acknowledge one more individual. We have this statement at the bottom here, ideas from patients and families, nothing about us without us. We have the fabulous Helen Starr, who has created that tagline from us from the general PFAC. So thank you, Helen, for that. And with that, I just want to say thank you. There's a whole lot of people that have made this possible. We have a steering committee that consisted of all of the PFAC chairs. We have judges that came from our collaborative governance group. We have our sponsors. You'll be hearing from Eric. You've heard from Inga and Deb already. Our IS team. We wouldn't have had a platform if it weren't for our IS team to create the platform. And then we have the planning committee and advisors, the group. Many of those are here today or that you've been in touch with. So thank you, everybody. And lastly, I would like to introduce, and it's an honor and a pleasure to formally introduce Eric Isselbacher, who will close the session today. Eric is a cardiologist and co-director of the Thoracic Aortic Center at Mass General and founder and director of the Healthcare Transformation Lab. He also holds the distinction as the inaugural incumbent of the Edmund N. Anson Endowed Chair in Healthcare Transformation at Mass General Hospital. It's his recognition of the value and importance of the patient voice, combined with his clinical experience and expertise in research and innovation in healthcare delivery, that has brought the EDC program to all of us today. So, Eric.
Well, thank you, Paula. Thank you all for being here. This is such a treat. When we founded the Healthcare Transformation Lab, one of the keys was to try to get the members of the MGH community to bring their ideas forward. And a lot of people have great ideas, but it's very hard to walk into your chief's office and say, I'd like to do this or I'd like to do that. Usually you don't get much traction. And that's why we launched the Ether Dome Challenge as a way to formalize the process, not just accept ideas, but encourage ideas from frontline providers across the hospital. So we initially launched it in the Heart Center. We did it twice in the Heart Center. We then went on and had an Ether Dome Challenge in the Cancer Center, in the Department of Surgery, and then with nursing and patient care services, and all those were very successful. And we had celebrations like this, and it was lots of fun. But in my 26 years on staff here, the fundamental issue is the patient. And as I round every day on the inpatient service and see the challenges that patients have, it's very clear that no one understands it better than the patient or the family members at the bedside. And yet there is no clear pathway for patients to bring their ideas forward. So from the very inception of the Ether Dome Challenge, it seemed like the ultimate goal. Once we proved that this challenge would work, that good ideas would come forward, that we could turn them into reality, and that hospital leadership could embrace such a program, ultimately, we wanted to bring it back to the patients. Patients and families, PFAC is the perfect place to start this. So we want to have patients be able to express their concerns and ideas to improve their experience, their care, and the efforts that families go through in caring for their loved ones by being able to formally submit ideas about inpatient and outpatient care. We are all better off if our patients are better cared for and the experience is better. So this was a challenge, though. Running an Ether Dome challenge in a department was hard enough, but to do it for all patients at MGH would be a little bit too big an ask. So we wanted to do this pilot with people who we knew cared about the institution and cared about the patient experience. So this has been a great success, and we're incredibly grateful to all of you for your participation in proving that this is important and can work. So now our job will be to figure out how to expand this. I know that Deb and Inga will provide lots of resources to do that so that we can invite a large number of patients to hear what their concerns are and to try to improve care for everyone here at Mass General. So this is just the first step. There's lots of work to do, but we're surrounded by an incredibly gifted and committed team, and we look forward to the next step in the process, which is expanding this more broadly. So on behalf of everybody, I would just want to thank you again for your participation, for being here today. It's nice to get together with people again, and we look forward to seeing all that the Ether Dome Challenge can do with our patients and their families. Thanks very much.
So that concludes our program.
Had to get it in.
Thank you, everybody, for joining. And we are going to have a couple more photos with all the groups, but really appreciate you taking the time out of your day to join us today. So thank you.